So for clinicians, this study gives us some really important information. It's looking at the impact of doing a single PSA test on mortality at 10 years from prostate cancer. That's really important from a UK standpoint, and I believe more widely than the UK, because that's actually in practice how a lot of men are diagnosed. They're not diagnosed from a formal screening program. They're diagnosed because they've been to a healthcare professional, very often it'll be their GP, and they will have a single opportunistic PSA done. Really, the argument for introducing a screening program based on a single PSA test is very weak, and to my mind, it just cannot be justified on the basis of these data. Of course, there are caveats. These are 10-year figures. With a disease like prostate cancer, we always need to know what's going to happen at 15 years, at 20 years. And this is, of course, looking at the impact of a single PSA test. It's not like some of the other screening studies which have been done, like the ERSPC or the PLCO, which were looking at sequential PSA testing. But it's hugely important data which I believe should really impact on clinical practice and the way that PSA is used in a healthy population. The other thing which it doesn't address, of course, are patients in very special groups. So men who might be at particularly high risk of developing prostate cancer. For example, men with a very strong family history and large numbers of family members who had prostate cancer at a very early age. Now, those sorts of men were not really the subject of this study. It's not what it was there to address. It looks at the effects of a single PSA test in the general population of men. So for men who are worried about prostate cancer, thinking about having a PSA test done, I think this is important information, and every man should know about this study before he agrees to have his PSA done. Men will generally be doing this because they think it's a good thing, because if they catch cancer at an early stage, it's bound to be better. And of course, what they want from a personal perspective is to have a test that will prevent them from dying of prostate cancer. This study shows that the PSA, a single PSA test, is just not the way to do that. So, where do we go in terms of screening for prostate cancer? And the case for having some sort of screening is unarguable, because we have 11,000 men a year dying of prostate cancer in the UK. And clearly, if we had a way of diagnosing and treating them early, that would be hugely important. The problem, and what this study has uncovered, is that PSA is just not the answer to that. We need something else. And I think what we need is a combination of a better way of identifying men who are at high risk and who therefore need screening, as opposed to the men in the general population who don't. And we need a better test than PSA. And a combination of those two things, I think, will be the way forward.